What are good questions to ask the radiologist? Some clinicians feel intimidated about approaching the radiologist and asking questions. So let me help you out with two of my favorite questions to ask radiologists. The first question is about where exactly is the lesion, and the second question is about what is the brain health of this person. Now, if you know me, that's not a surprise that I'm asking about the exact location of the lesion, because it makes a difference whether the lesion is in the frontal lobe, parietal lobe, occipital lobe, or temporal lobe. Furthermore, it makes a difference whether the lesion is medial or lateral. If we take the example of the frontal lobe, it makes a difference whether the lesion is in the anterior part of the frontal lobe or the posterior part of the frontal lobe. And if it's the anterior part of the lobe, is it the superior, the middle, or the inferior frontal gyri? That makes a functional difference as well. In fact, that level of specificity is important in each one of the cortical lobes. Let me give you an example of a case I was discussing with my students recently. And it was a case of a guy who had a stroke, a young guy. And when we analyzed the lesion very, very carefully, we could see that it affected the inferior frontal gyrus, it affected the lower part of the primary sensory and motor cortices, and it affected the inferior parietal lobe. In fact, it affected the angular gyrus of the inferior parietal lobe. We could see that although on images it looked like the lesion was quite posterior, it didn't affect the occipital lobe, and we could see that it extended inferiorly to affect the superior temporal gyrus. Knowing this information was really, really important because it became very, very clear that the main problem this person is going to have is the expressive language and the receptive language. And it became really important that the first assessment that everybody needed was in fact the assessment of the speech pathologist. She will be the person, or he will be the person, that will direct us with regards to how to communicate with this person. This also means that in terms of prioritizing treatment, we will have to prioritize the speech pathologist over the rest of the disciplines. So looking really carefully at the lesion really makes a difference to how you assess and how you treat the person and what you prioritize. When I think about the brain, I also think about the deep structures and the brainstem. And if you think about the brainstem, it is really compact with structures. So a lesion in the posterior medulla, for example, will have an impact on sensation, it will have impact probably on swallowing, but a lesion on an anterior pons might have a cognitive function. And if we're talking about anterior midbrain, then it might be a really important motor component to the dysfunction. So you need to identify whether the lesion is in the midbrain, pons, medulla, and where exactly is the lesion. The second question is about brain health. And this is something that radiologists may not be very comfortable in answering. So instead of asking a general question about brain health, you might want to ask specific questions. And let me help you out with that. But before I start to do so, I want to give you an example. I'm a physiotherapist by training, and I want to give you the example of an ankle sprain. The way I treat an ankle sprain in an older person who usually sits most of the day and just uses a four-wheel frame for short distance walking, say from chair to chair or chair to bed, is very different from the way I treat an older person who had an ankle sprain but lives a very active lifestyle, perhaps plays tennis a couple of times a week, and needs to be able to go to that level of function. So it's the same age, it's the same problem, ankle sprain, but I'll be treating it differently. In fact, the treatment principles will be the same, but the way I conduct my treatment will be different. So it's similar with brain health. If someone has a lesion to their brain, but their brain health is not very good, I'll be treating it slightly different too if they had a healthy brain. And what makes a healthy brain? Let's have a look at that. The first thing for you to think about is cardiovascular risk factors. Now, they're usually used in the context of heart disease, but they're also used in the context of stroke, because if the blood vessels to the heart are affected, the chance is that other blood vessels in the body are affected, such as to the brain. So you want to assess things like what is their blood pressure, what is their cholesterol level, are they obese, are they active, are they smoking, what sort of diet do they have? There are things that will tell you what kind of health is there for the blood vessels of the body. If they had a stroke, you want to know about it. If they had previous strokes, they may not even know about it. It's something that might show on the scans, so you can see it if you're brain imaging trained or if you ask the radiologist. So you want to find out about old strokes. You also want to find out about underlying processes in the brain. For example, you might want to know about little blood vessels that might be clotting up and causing little infarcts around them. This is not stroke, this is different from stroke, but you can see it on brain imaging. If you're brain imaging trained, you'll be able to see it. If you're not, again, contact the radiologist. If the blood vessels are fragile, they might have little bleeds, like micro little bleeds. And that is also something you can see in brain scans. And you can ask radiologists about it if you don't know how to look at the brain images. So you want to know about those underlying processes that are going on in the brain. Did they have an old stroke or old tiny lesions that you can't see? Do they have many little lesions in different parts of the brain? Do they have micro bleeds? The next step you want to talk about is brain age. Now, radiologists are not very comfortable talking about brain age, but you can ask them about whether the atrophy you see in the brain is what you would expect for the age of the person. Now, brain age is a topic that is hot in the neuroscience community at the moment. And this is because there's a lot of research into the fact that the brain could be older than the chronological age, or appear older than the chronological age, or it can appear younger. And this is similar to a scenario you might have experienced it yourself. Think of an 80-year-old person that you treated that you wouldn't give them a day of a 60. Or a 60-year-old person that behaved as if they were 90. The way you treat them is different. The way they appear is different. What they're going to be able to achieve is different as well. And it's the same with the brain. Some brains are more youthful compared to the chronological age of the person, and other brains appear older than the person is. So you want to know about that as well. So in summary, when you ask radiologists about brain health, try to be a bit more specific. Ask about old lesions. Ask about little infarcts around the brain that may be subclinical. Ask about little microbleeds in the brain. Is there evidence of that in this brain? Ask about atrophy of the brain. Is this person appear to have atrophy that is significant or more significant than you would expect for their age? So by asking those two questions about the exact location of the lesion and the brain health of the person, you can extract a lot of information that will help you in your assessment and treatment. I hope now you are less intimidated about asking questions to the radiologist. And if you found this video useful, please like and share it and tell other colleagues about it as well. I will see you in the next video.